Hi there everyone, and welcome to PsyCro Research. My name is Estienne Cronje. We at PsyCro Research have been wanting to start our vlogs and social media accounts for the past few months and thought now is probably the best time if there ever was one. The following few weeks our vlogs and articles will discuss the psychological impact of the COVID-19 and what researchers have found in the past regarding social isolation and pandemics. The current pandemic we are facing around the globe causes deep concern for each and every one of us. On top of our physical health being a big concern, there is also an overwhelming concern for our mental well-being. Many researchers are currently concerned that the psychological effects, the consequences of this COVID-19 will outlast the pandemic itself. This is not just applicable for the individuals that have pre-existing psychological disorders, which essentially means that this global event could trigger psychological stress of various degrees, such as in anxiety, health anxiety, obsessive-compulsive disorders such as OCD, compulsive disorders, depression, people who suffer of claustrophobia, and panic-related disorders, and this is only naming a few. So today, we are going to focus on anxiety. We will be looking into some of the triggers and causes thereof during this troublesome time. Many of us personally or a family member have a history of anxiety or might now be experiencing it for the first time because of this pandemic. Because we have limited resources in isolation or quarantine for managing our anxiety, we decided to discuss some points on managing our anxiety and ways of preventing it from occurring in the first place. So anxiety is a normal part of life, such as experiencing the feeling of having a knot in your stomach and being nauseous before a very important interview, or maybe the feeling of being worried during this unfamiliar time. And that is only to a certain extent, but it remains normal. When we consider disorders, anxiety is one of the most common disorders in the general population, and can be described as an indispensable human emotion that prepares us for the fight or flight response, which I'm sure everyone has heard of. The region in our brain that is responsible for this is the amygdala, which is located here at the base of our brain. This region is responsible for helping us store memories that are associated with emotional events, and thus plays an important part in our triggers. So in essence, anxiety is a fear that manifests as a future-orientated mood state that has a cognitive, an affective, a psychological, a physiological, and a behavioral response system, which is associated with anticipated events or circumstances which we perceive as threatening. So if we simplify that mouthful of words, anxiety is basically what we feel when we are worried or we are tense or we are afraid of something, and it's particularly about something that is about to happen or something that is going to happen in the future, such as contracting the virus, for an example. So it's important to know that anxiety is a natural human response, which is essential, and it's about something that we perceive as threatening personally to ourselves. And this can be experienced through our thoughts, our feelings, or our physical sensations. Some of us might explain having anxiety as feeling on edge, with a constant fight or flight response being activated when anxiety is present. So it feels like you want to run away or you are going to stay in fight, the fight or flight response. We overthink our situations and we need constant reassurance that our thoughts are valid. Even if we think that they are not rational, our brain tries to convince us otherwise. Another way of explaining it is like breathing through a thin straw after you have exercised or ran up a few flights of stairs. So you can never really be able to get enough air in, and it's a constant state of panic, while there's a feeling of weight being added on your chest every time you exhale. Some things we can keep in mind or look out for during these stressful times, and it includes some of the following. Number one, keep an eye on our pre-existing psychological conditions and that they don't worsen over time. This includes conditions that are related to phobias, compulsiveness, stress, depression, and anxiety. Number two, if we notice ourselves or notice a loved one having constant ruminating thoughts of the virus that are intrusive of nature and we feel it can't be stopped. Number 3, severe anxious or anxiety symptoms such as heart palpitations, difficulty breathing, chest pain, and excessive headaches. Number 4, it is also possible to experience vague psychosomatic symptoms that have no medical basis. More things that we can consider includes irritability, helplessness, hopelessness, negative thoughts, mood swings, and so on. However, it is very important to always remember and consider what I have just mentioned with the individual's normal personality and characteristics. Ask yourself if the person or yourself is acting out of character, and is there a pattern regarding their behavior that's forming. This constant feeling of anxiety could lead us to show repetitive behavior such as washing our hands excessively or excessive use of hand sanitizer. We might increase the amount of showers we take during the day, and eventually it can show up as obsessive behavior with regards to news, social media, internet searches, and so forth about the COVID-19. This behavior has a negative effect on our sleeping patterns and our appetite as well as our attention spans. The reason this is worrisome is because sleeping and healthy eating habits are crucial for our physical and mental health. And an individual that has a decrease in the attention span, for an example, could lead to actually forgetting to drink their medication in the morning or getting confused whether or not they drank it in the first place. So please remember that having control over our anxiety is beneficial for our health, as many clinical studies have proven in the past that anxiety that is not managed increases our risk to develop chronic medical conditions.